Today's discussion will talk about sleep as a public health priority and why it matters and why we should do everything possible to improve it. I'm Dr. Robert Carter from the Chicago School, the Masters of Public Health program. And the reason why I chose this topic today because there's a lot of discussion going on social media, TikTok, that is just talking about things like mouth taping as a way to improve sleep quality. So, as an individual that spent a good portion of my career researching human performance, one of the things I was introduced early in graduate school was sleep. And in graduate school, we did a number of studies looking at things like sleep deprivation. We did work on sleep apnea, and it really exposed me and provided me with an opportunity to really understand sleep, the physiology of sleep, and most importantly, how important sleep is to everyday human qualities, in particular, mental and physical health. So, as I mentioned before, a lot of discussion on TikTok and other social media platforms about sleep. And the one I want to address specifically today, as we talk about sleep as a public health priority, as a public health issue, is mouth taping. So, there's been a lot of conversations that I described around, should individuals use mouth taping as a way to improve their sleep quality? And as an individual that personally suffered from some sleep disorders, such as sleep apnea, I'm very attuned to this. Also, I'm actually certified as a breath coach. And so I want to first to start off talking about the importance of understanding the types of things that you might hear about that you may think are initially beneficial to improving sleep. So mouth taping, I would like to foot stomp and start off. It can be particularly dangerous, and I'll talk about a little bit why mouth taping can be dangerous. Well, many individuals suffer from deviated septums, which basically mean the bridge that's in between the two nostrils. Sometimes it's slightly cantered to one side or the other, and that can result in a number of breathing challenges. So, this is one of the reasons sometimes individuals will suffer from mouth breathing. Also, severe cases of sleep apnea or central sleep apnea or other conditions where individuals may have episodic or periodic periods where they stop breathing, doing things like mouth taping can be particularly dangerous as well, and can actually lead to other more complicated scenarios such as sudden death. And so it's critical that prior to taking on such extreme ways to improve sleep quality, it's important to actually talk with the healthcare provider, actually do a sleep study, make an appointment with your primary care physician, and then, if necessary, get a referral to a sleep specialist that can actually perform the appropriate sleep test to help you understand what your options are to improving your overall sleep quality. And often what you find is that individuals may suffer from mild to moderate sleep apnea or other conditions such as um, narcolepsy, a wide variety of reasons, restless leg syndrome, periodic limb movement disorder. These are all ways that individuals, from a physiological, from a clinical perspective, may find themselves not sleeping as well. So, anybody that's watching the video, I'm actually doing a live poll. The question I actually have today is really, do you get 7 to 9 hours of sleep per night? And so that's the question that I really have for you today. Do you get 7 to 10 hours of sleep per day? And I think for many individuals that may not necessarily be the case, but it's important for you to, okay, think about that. Why should I get 7 to 10 hours of sleep? How does that actually improve my overall sleep quality? And what are some options that I may have? Well, first of all, I'd like to say that we really don't fundamentally understand the benefits of sleep. Well, let me say We know the benefits of sleep, but we don't always have the correct answers on why individuals need to sleep 8 to 10 hours or 7 to 9 hours, whatever that number is. But we do know that restorative properties within the brain, within the muscle, within the various system, we know that those systems actually are restored and begin to actually reset during sleep. But again, what we don't know always is sleep in particular required for those systems to actually reset. But but we also know that the reason why I put this question, do you get 7 to 9 hours of sleep per night, is because we know that most Americans, most really people around the world, don't actually get the required amount of sleep. So I wanted to take the time today to just have a brief conversation with you about sleep, why sleep matters, and such. So we know that sleep, in fact, is a public health issue. Sleep deprivation, we know, affects individuals and society at large, leading to things like automobile accidents, errors, medical errors, mechanical errors, a whole variety of those. And we also know that that poor sleep, sleep deprivation is not getting 7 to 9 hours of sleep. We know those situations are also associated with increased risk of disease and increased morbidity associated with disease. So if you have a condition like if you're suffering with diabetes, cardiovascular disease in particular, we know that individuals that are chronically sleep deprived have an increased risk of those conditions getting worse. In some cases, individuals may actually die as a result of chronic sleep deprivation or poor sleep quality. And also, we know that 35% of adults report getting less than 7 hours of sleep. Imagine that. One third of all Americans report getting less than 7 hours of sleep. So essentially, sleep, again, as a public health priority, there are very few conditions that you can think about where a third, that means that out of three people, one of them will have chronic sleep deprivation. And as I described before, we know that poor sleep deprived individuals increase risk of automobile accidents, increased risk of worse disease. If they actually are disease free, we know that that can also lead to increased risk of developing certain types of disease conditions. And so when we think about individuals that are more susceptible to this problem, healthcare workers, wow, the individuals that are within the population to help us address health issues are one of the populations at greatest risk for sleep deprivation because they often work shift work and stuff like that. So we also look at service industry. So anybody that basically is working shift work, unpredictable schedule, going into work at different times of the day, are at a higher risk of chronic sleep deprivation. Why is that? Because the sleep cycle can continuously disrupt it. So those individuals have to be particularly careful. We also know that sleep or lack thereof, from a public safety perspective, results in an estimated 100,000 crashes per year, with some percentage of those crashes leading to certain types of poor outcomes to include fatalities. We know Wow, we also know that medical errors increase during the night. We also know that individuals also, if they're in a hospital, are at a higher risk of dying. More deaths occur at night. And so, again, it may not necessarily be the medical errors leading to that, but it is a time when individuals need to have when they need their healthcare providers paying particular attention to them. And we also know that sleep loss, particularly in first responders, military members, has been linked to poor judgment and burnout. Wow, can you imagine that? So a lot of the individuals that we depend on to take care of us are at the higher risk of sleep deprivation and burnout. So this is particularly concerning. We also, as I mentioned before, poor sleep, sleep loss, insufficient sleep is also associated with things like insulin um, resistance, metabolic syndrome, inflammation. So as well as higher blood pressure. So many of us, just by getting adequate sleep, can actually address some of the conditions that we actually take a lot of medication for. So, how many individuals in America actually suffer from diabetes, or they're pre-diabetic? And again, that's related to insulin resistance, meaning your body, as it as you eat, you take in sugar. Either the body is not producing enough insulin, or the amount of insulin that the body is producing, and the interaction of that insulin with cells and receptors on the cells don't allow that amount of insulin to actually provide the physiological response necessary for the body to actually take that glucose, that sugar that you've eaten, into the cell to provide cellular function, but that sugar actually circulates at a higher level within the bloodstream. So the last sort of big chronic condition is that we know that mental health, and later this month we'll actually talk about mental health in particular, so I won't spend too much time on it. But May is Mental Health Month. It's the month that we actually focus on mental health. We know that bidirectional relationship exists with depression, anxiety, and PTSD. And believe it or not, is directly as correlated with sleep restriction, poor sleep outcomes. So poor sleep can actually be a symptom and a cause of certain mental health disorders. So I hope that at least up to this point, you're beginning to recognize why I selected this topic to talk about today, and that you're beginning to recognize that, in fact, sleep is a public health priority, and why it matters, and why we should actually improve it. Do things that really improve sleep, not gimmicks and things that can put you at risk of sudden death and stuff like that. So when you hear things on social media, it's important for you to thoroughly look at it. Does it make sense? Is it right for me? And then most importantly, have a conversation with your healthcare provider. Because the worst thing you want to do is actually have a bad situation that you actually make it worse by not actually doing things that's going to overall improve. So it's sleep, and I'll get into sleep and the economic and the social cost. And so we know that poor sleep isn't just a health risk, it's an economic liability. And what do I mean by that? The Rand Corporation estimates that $411 billion in potential economic benefit to the United States is lost due to sleep related issues. And why is that? Because we know that poor sleep is associated with a loss of workforce productivity due to folks not being present at work or really being absent from work, and how productive they are within the workplace. So sleep contributes to many, many, many days per year, thousands of person days per year of individuals not being actually present for work. They wake up so fatigued that they actually can't actually show up for work. And some individuals actually lose their jobs because they're chronically absent from the job, or they fall asleep at their desk, and a whole host of issues. But the bottom line is tied to poor sleep quality, sleep deprivation, and it's something that can be addressed. But you actually have to take ownership of it and truly identify what risk factors, what issues are leading to your particular sleep issues. So certain industries we know are at greater risk, as I mentioned before, healthcare workers. So fatigue-related medical errors. What that is middle of the night, a healthcare provider is taking care of patients. Um, Sometimes they will give patients the wrong medication, which in some cases, if you give certain patients certain medications, that can lead to very poor outcomes, to include death. But in many cases, it will make their condition worse. So it's critical, obviously, when you're unfortunately in a hospital and concomitantly you're surrounded by sleep deprived individuals, there's some increased risk of you getting the wrong medication or not getting the actual care that you actually need, to include maybe you're in a scenario where you require individuals to maybe move your body position, and we know that individuals don't actually receive that care, that are increased risk of things like pressure sores, commonly known as bed sores. And so it's just so important, not just in hospitals, but also nursing homes or other types of facilities where individuals may be introduced for maybe a short period of time or a longer period of time. And as I mentioned before, I've already talked about less productivity, more likely to call in sick, and they're more prone to accidents and errors. So now we'll get into a little bit about what we talk about as sleep disparities. So sleep is deeply shaped by the social determinants of health, and not all communities have an equal opportunity for restful sleep. So, why is that? So, if we look at certain individuals and certain populations, report just in general shorter durations of sleep. Low income individuals often work multiple jobs. As you can you imagine that? They work day shift, night shift, and they often live in inner cities or in areas where there tends to be a lot more noise, whether that's an ambulance, police, or just in general highly densely populated areas where individuals may be playing music loud at night, or there's just some increased risk of crimes as well. So you can imagine if you're in a neighborhood and you're constantly subjected to a lot of noise, you're coming in all times of the night. People are coming in all times of the night. A lot of noise, traffic, getting sleep, having good sleep hygiene in those type of environments can be particularly challenging. We also know that women, caregivers, and those with mental conditions also face compounded barriers to getting good sleep. And so, as I mentioned before, some of the contributing factors that we know about is things like urban noise, light pollution, overcrowded housing, all factors that individuals may find themselves more subjected to in a crowded inner city area. And also earlier start times and lack of workplace fatigue policies. So individuals that tend to actually have blue collar jobs where they're under a lot of stress, high tempo, tend to actually the consequences, if you will, of sleep loss, poor quality is magnified. Whereas individuals working maybe in a desk or where they don't necessarily have as a requirement for documented high throughput. So you can imagine someone working at a fast food restaurant, you're there's a continuous flow of a requirement for you to produce, as opposed to someone working in a office. They can walk away from their desk, clear their head, and there's no immediate consequences. But when you're in certain occupations where we tend to have more lower income individuals, that can lead to some chronic issues with sleep and a whole host of other public health issues. So sleep inequality is public health is a public health equality issue and it mirrors the same structural disparities that is seen in other health outcomes. So when we look at what are some public health interventions that we can do to address this, and one of the most important things, which often leads to complications, is that it must be evidence-based. And that's why I go back to the conversation around mouth taping without necessarily consulting your physician. And there are multi-level strategies. Obviously, when we talk about public health, we're not just talking about individuals, but we're talking about ways that we can address at the individual level, at the population, community level, ways to overall improve a situation. We often talk about this as system thinking. How can we systems think our way out of a problem? And so, first, one of the most important things, that's what I'm doing today, is actually having a conversation, providing education on sleep hygiene. And one of the things that we talk about, if all possible, as I mentioned before, we know there are populations that this is not easy to implement due to multiple jobs, healthcare workers, and shift workers. But if at all possible, if it's something that is possible for you as an individual, and that is consistent routine bedtimes. And one of the things that many of us can actually do, which is where we often get bad information in the first place, and that is from certain social media and certain basically things that trend, like mouth taping, where we're not getting adequate information to help us understand what we actually need to understand. So with that said, avoiding screen times at least 1 hour prior to going to bed is a great way to actually promote sleep hygiene. Also, limiting alcohol and caffeine intake several hours before going to bed, if at all possible, can be useful. But you can imagine individuals that's working multiple jobs, maybe getting off one 10-hour job, Ubering, driving Ubers for 2 or 3 hours at night, and then maybe have another job where they may providing cleaning services, and just to get home at 3, 4 a.m. and do it all over again. And so they're looking at very, very short amounts of time to actually have adequate sleep. But that's one of the ways. And also, we talk about another way is individuals sometimes will cope by taking sleep aids, and sleep aids can be sometimes detrimental. Let's face it, over-the-counter sleep aids, as opposed to looking at if you suffer from insomnia, doing things like cognitive behavioral therapy for insomnia. And you may be like, wait, we're talking about the people that are most susceptible to sleep issues are folks that's already strapped for time. And what I always like to say is that you have to identify what is going to provide the maximal benefit. So there are things that I can actually do to improve my quality of life, improve my sleep, then I should be looking for those things that, yeah, it may be a time investment, but there's a long-term benefit. And so you have to use, that's why I said evidence-based, a multi-level approach. So, for example, getting off work, not using the phone an hour before going to bed could be useful. It's something that's relatively easy to implement. And again, doing it all possible, avoiding alcohol and caffeine hours before going to bed is also things that doesn't really cost you anything. In fact, it probably costs you, it's a cost avoidance by avoiding those. At the community level, this becomes a little bit more complicated. I got it. But improving housing conditions. So this is something that we really have to do collectively, is look at, okay, how can we improve housing conditions? Okay, we think about safe and dark areas and cool areas to sleep at all possible. So again, sleeping with the television on, sleeping with bright lights is probably not as good as sleeping with in a dark, cool environment. So that may not be possible for everybody all the time, but putting things like blackout curtains if you work shift work, or if you live in a highly densely populated urban area where there's lights and street lights and other things that may be disturbing you. You can actually, use blackout curtains, hang two sheets, whatever you have. You don't have to make it overly expensive and taxing, but anything you can do to personally help yourself, help individuals within your community can be incredibly valuable. And like what I'm doing today, where I'm delivering information about sleep, that's something that we can all do as public health professionals, and that is to partner with local organizations to deliver sleep education workshops and really begin to talk about, okay, what are some of the barriers to sleep, identify one or two things that you might be able to do, and that can make a difference. You're not going to be able to make a difference in everybody's life, but if you have an opportunity to make any improvements in somebody's life, you're making a difference. And at the policy level, this becomes more long term, a little bit more complicated, but we look at things like, particular for kids, having later school start times. Unfortunately, when you look across the spectrum, because of higher busing requirements, longer rides, and just getting everybody settled in. What we tend to see is earlier start times in schools in some of the higher urban areas, also more lower socioeconomic, which also again adds to the social determinants of health. Worse workforce fatigue management plans. So by even individuals that are working in high throughput, sometimes lower paying jobs, actually working with managers to say, hey, look, if we incorporate workforce fatigue, workforce policies, then you'll get a better product out of individuals. You'll get more productivity. And sometimes having that conversation is difficult, but maybe giving folks, 5, 10 minutes off every few hours, especially in high throughput environment, or working 50 minutes and off 10 minutes. Just simple strategies sometimes just to allow the brain that's already fatigued, that brain that hasn't received 7 to 9 hours of sleep and is constantly draining. I actually wear an Oura ring, and that's something that you can do. There's lots of other devices that can track, when you're getting into that decline phase. And and again, we don't necessarily need electronic gadgets to tell us that. We can often feel it. And so by effective workforce fatigue management plans, that can actually be a way of actually doing that. And then I would say better integration of sleep screening at primary care visits. So when you visit your doctor, even if it's once a year, um, have sleep as a conversation. They may not necessarily be to provide the best information per se. They may ask you a few questions, but they may not necessarily have a lot of answers. But again, that can be integrated into your overall care plan. Specifically, you suffer from certain chronic diseases like insulin resistance and diabetes, cardiovascular disease, high blood pressure. Many of those are how your primary care physician treat your primary condition or your specialty care with a specialist, by looking at sleep quality, and ways to basically support your sleep is going to be important. And so one of the important aspects, again, behind the science of sleep, as I mentioned before, we don't fully understand why you got to go to sleep, why you need it. A lot of what we know is the consequence of not having it. Okay, so we know that sleep in particular supports memory consolidation and learning. We know that the immune system that's in a dump for sleep, that's fatigued, tend not to function as well. So you're more susceptible to getting certain types of diseases and a whole host of challenges. As I mentioned before, glucose metabolism. What is that? That is basically the insulin and sugar and how your body basically prevents having high blood sugars prolonged. That leads to a whole host of conditions to include diabetes and increased risk of cardiovascular or degraded cardiovascular function, stroke, and heart attacks and the like. We know also that the brain, judgment, decision making, people that are chronically fatigued, chronically in the gutter, tend to make gutter decisions, worse decisions. And so sleep is not a passive state. We have to remember that. You say, okay, I'm gonna take sleep to get rest. Well, it's not a passive. It's a very active and it's essential to certain biological processes. Can't tell you exactly why we need it, but we know that when we don't get it, what some of the consequences are. And so the last thing I'll leave with you today is some takeaways, and I want to make sure that that you have some actionable items. We've talked about a lot of things. You can always my contact information is there on the screen. You can always reach out. Be more than happy to talk with you. But sleep health is a shared responsibility. Improving it requires awareness, access, and systemic support, meaning if you're in a situation where you're chronically deprived, you're not alone. There's 1 billion people at least in the world that suffer from sleep apnea alone, let alone sleep loss and other factors. Okay, so sleep should always be part of a conversation when you're attending your physician visit. As public health professionals, we got to do a better job as far as public health campaigns around sleep. And then in particular in the school setting, it got to be part of the conversation around the sleep curriculum because we know that the schools are getting kids that are chronically sleep deprived. And so if they don't actually acknowledge that, that's going to be a bad day for the teacher, behavior. We know as individuals are chronically fatigued, sleep loss, they tend to be more irritated, agitated, and just tend not to be people that you want to be particular around long periods of time. And so you can imagine school is like 22 to 30 to 40 individuals maybe in a classroom, and they're a little bit more irritated. Also, a consequence of overcrowding in urban areas, you tend to get more kids that sleep deprived in a classroom, and they can be particularly angry and agitated. With an agitated teacher, you got a situation that is going to lead to more sleep loss, more negative outcomes. So I encourage participation in, first of all, evaluating your own sleep. How do you feel? Some individuals can get by with a lot less sleep for longer periods of time and still function, but that's not the case for 90% of the people. I did a lecture once on, well, I was interviewed by a newspaper after publishing our book, The Morning Mind, and one of the questions was, and you can find this online, Dr. Robert Carter, and if you look up, are folks night owls or are larks? And so the bottom line is that people say, well, I'm a night owl, so I don't need as much sleep. Well, I hate to disappoint you, but there are very, very few that truly are night owls. Most of us actually need to go to sleep. And so it's important for you to actually have the appropriate assessment of what your challenges might be so that it's not something that you are fixated on or that you believe about yourself that's not necessarily factually accurate. And so the second thing is we have to consider how work interacts with sleep. So it's important to actually have that conversation. And then when you learn something or you get some information, share that information, especially if it's not just some random thing, but information like you're receiving today. Share the information, have folks watch the video, and because sleep is not a luxury, it's a biological and social necessity. Okay, I'll say that again. Sleep is not a luxury, it's a biological and social necessity. So, just like you need sleep, your neighbor needs sleep, your kids need sleep, everybody needs sleep. Okay, even we have a hamster which tends to actually not sleep while we're asleep, sleeps during the day and runs on the wheel at night, keeping us awake. But the reality, even that hamster understands that that sleep is not a luxury, and that hamster's probably asleep now. Okay. So I'll leave you with 3 questions. What barriers to good sleep prevent you from getting the sleep that you need? What barriers to good sleep does your community face? So think about your community. What is one change that you can make that will promote better sleep in yourself and within your community? And how could sleep screening be incorporated into your particular way of life? What I mean by that, how could public health, healthcare help you better screen some of the sleep challenges that you currently have, or you may know of others that they are struggling with? So I'll leave you with sleep deprivation affects individuals and societies, leading to decreased life expectancy. I think all of us want to live a long life. Also, we would like to live as best as possible, disease free. We don't want to be in a situation where we're in a hospital and individuals are making medical errors, or even outpatient, or even just going to the doctor in general, or the pharmacist giving us wrong medication. And another aspect is that we don't want sleepy people on the roads causing accidents, impacting maybe the people that are not sleepy. And so we got to address this and look at this as a systemic public health issue. And the only way we're going to change this is to change it together. So please join me on a public health campaign to improve sleep, understand why sleep matters, how you can improve it for you, yourself, and your community. Thank you.